upper back area pain, right about here, or upper shoulder pain, you've been getting it treated all along, but it's not getting better. What if you're actually treating the wrong area? And what if the cause of this pain is not from here? This is not where the pain is being generated from. What if it's from somewhere else and you're never going to get this treated well? Well, that's what this video is about. I'm going to show you that how these referral patterns can be coming from a completely different region, and if you don't treat the actual cause of the area of pain, then you'll never get this resolved. Hi there, my name is Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And if you enjoy this video and you get value out of it as you watch it, go ahead and subscribe to my channel because I give these types of tips and information on my videos on a regular basis. Now, let's say you have upper back pain region. It is very possible that your pain can be coming from the neck. And this poster here, which is from Chiropractic Biophysics, they actually summarize pain patterns from the neck region that was established from research that was done in 1990 in the Spine Journal. It was a two-part research project, part 1 and part 2, and it was a foundational study. And what they discovered was when they stimulated the facet joints, what that means is the joints of the spine, the cervical spine right here, they have ligament capsules around them. And when they injected a contrast medium in there, it stimulated a pain response, an inflammatory response, which caused pain. And they were able to ask the test subjects, and these were normal patients, meaning they had no clinical symptoms of neck pain or upper back pain or shoulder pain or headaches. They asked them where they felt their pain, and to their surprise, the pain was not just localized in the neck facet region, but was referring to other parts. And they were able to map this out into a poster or a map that looked just like this in a research study. So what they found was that the C1, so COC1, the facet capsule up here, actually refers pain to the head region. So if you ever had lateral head pain, upper suboccipital area pain, especially on one side or both sides, it can be coming from COC1 facet, or even C2, C3 facet they found refers over here. And if it's that regional suboccipital area pain, that's C1, C2 joint. So in other words, if there's a headache region, for instance, a headache pain, it can be coming from the upper neck region. We'll get to the shoulder and upper back in a moment. Now, if you have localized neck pain in the middle area, that's the C3, C4 facet, C4, C5 facet, which is typically the middle part of the neck here. Now it gets to the shoulder. The C5, C6 joint, the lower neck now, C5, C6 joints in here, they refer to the upper trap, and the C6, C7 joints refer to the scapular area. And a lot of times my patients will say, I have upper back pain, and they've been going to massage and physiotherapy and acupuncture, cupping, and they're working this area here, and it's not resolving. Then I go ahead and check their spine, and there's a tender spot in those facets. We now do chiropractic spinal adjustments specifically in those tender facet joints, correct the biomechanical distortion, and now this area, which I didn't even touch or treat, is resolving. So if you have pain in the upper back region, or I know I started with shoulder pain, but also in the headache region up this area here, and no one ever looked at the neck, then you need to look at the neck because these facet joints can be involved and they should be corrected. And doing massage won't be enough. Doing acupuncture won't be enough. Doing cupping won't be enough. Medications won't be enough. They may take the edge off the pain, but they're not going to correct the causation factor of those referral patterns. Now, part 2 of the study, which is really cool, it's referenced down here, is they actually want to see if they can actually predict these pain patterns in patients or predict where the pain was coming from in patients. So now they had patients with clinical pain. And what they did was the patient said, oh, I had pain in the upper shoulder over here. Then they went and checked the facet joint as C6, C7 and found there was a problem there. Or if a patient said, well, I have pain in the mid-neck over here, they checked that C4, C5 or C3, C4 area and realized that there was a problem there. So they found that this pain pattern that they were able to map out in study number 1 had a predictive value. And that was really a foundational study, and you can look it up on Spine Journal. I'll link them in the description below so you can see the abstract yourself. So the point of this video, you don't always treat where the pain is located. It needs to be investigated properly. And in my office, we do an examination, after a consultation, of course, an examination, spinal check, muscle check, posture check, and then we take x-rays and we determine from all that information if there's pain patterns in other parts of the body, if they're coming from the neck, and then we apply our corrective adjustments and procedures to improve that. If you found this video useful, go ahead and like it and share it with someone because they may also find benefit from it, and YouTube will find similar people to watch this video. Subscribe to my channel so you get similar videos coming up in the next week. And if you want to see how we apply corrective techniques to improve spinal misalignments, which can contribute to these facet irritations, we apply corrective techniques to necks that are either forward head position, cervical kyphosis, or military neck, and I do chiropractic biophysics corrective care. Go ahead and watch this video right over here because I show you the 3-step method that we use for chiropractic biophysics to correct necks like cervical kyphosis and military neck right over here.